Welcome back to Your Carolina. We are right here at the Michelin on Main inside stage. Of course, we have one outside for fall for Greenville. And it's wonderful to have, coming back to the show, Dr. John Lettieri. And you're with Carolina Plastic Surgery. That's in Spartanburg.
In Spartanburg, yes.
And you have been, you've been sending us information about a great event that you have coming up. Because I think that women have a lot of questions about plastic surgery, but sometimes, let's be honest, gals, we're a little intimidated to ask. So we'll talk about that event and where you can ask some questions, win some stuff, and have a good time.
Right.
But I want to go back to your last time when you were here. We were talking about something a little more serious, October, Breast Cancer Awareness Month, and we started with the breast cancer, early detection. And from there, a woman has many, many choices.
Lots of choices, Kim, and the choices are increasingly numerous and difficult to negotiate, including the reconstruction choices. So I think we're going to chat a little bit about what the timing would best be and what options most women have.
If a woman is looking at, because there is breast augmentation, and your event would probably answer some of those questions as well, but here today specifically, we're talking about reconstruction after a surgery. Do you plan that the same time as your surgery? Because I have a friend here in town who was looking at that as an option.
Right, so that's a very good question, and increasingly women, I'm hoping, are being told that reconstruction is an option for most of them. And ideally, we would like to see those women before they have their definitive cancer surgery. It doesn't mean that they should or are best suited for having reconstruction started at the same time. Some women are, but some women aren't. And some women just feel better not to have to make more decisions than are needed at the same time.
Tell me, in this picture, and I know it's graphic, but you know what? This is reality.
Yeah,
for these women.
so this was a younger woman in her late 30s who I saw who had already had her mastectomies, obviously. In her case, she needed both breasts removed because it was a bad tumor, maybe a family history as well.
Right.
And so we used some of the high-tech implants for reconstruction. Nipple reconstruction was also done, which is very commonly part of what women would choose to do.
I'm amazed by that, and I sit here and think that there is some woman sitting at home who thought, my case is too far, they can't do anything, and I look at that and that is amazing work you've done.
Yeah, so we see a fair number of women who have thought possibly for years that nothing is available for them, or they just needed a few years to be comfortable with the idea of having surgery again.
And you brought up a great point just a minute ago, and that was the fact that if you're going through, and I know it's a shock and a lot of things are there, but the whole cancer thing, don't be afraid to bring up the fact that to your doctor, something that will make you feel better afterwards, and that's reconstruction.
Right, and remembering that the timing for reconstruction is very flexible, whereas their tumor needs to be treated.
Right.
Women don't want to wait and shouldn't wait weeks and months, but reconstruction sometimes for some women is better to wait until after they've had their surgery.
That's interesting.
Yeah.
That's a very interesting point. There are, and we'll talk about some of the implants, there are some new products out there.
Right, so the so-called gummy bear implant or the cohesive gel implant is a very unique device, very suited for breast reconstruction. We also use it for augmentation. And then the other gel device is also a very modern device used for reconstruction and augmentation, but especially the cohesive gel gummy bear implant. It's what we almost exclusively use now for reconstruction, and fortunately our practice can use them. We're the only practice in the state that's able to use all of them, so it's become a very popular choice for reconstruction particularly.
Now, excuse me and don't take insult by this, but you're a man, so I'm going to talk to the ladies for just a second. That is the most real feeling thing I have ever.
They're very natural,
It is amazing.
Yeah.
It's utterly amazing, and it's bringing the normal back to a woman's life. It means a lot to a woman.
It really does. Women tell us all the time how they weren't sure about reconstruction. Maybe their husbands or their friends and family encouraged them to consider it, but it's the rare patient who isn't thrilled that they did it, ultimately.
Well, it's amazing stuff that we've seen even through the pictures. Let's talk about this event, because people can come with questions about reconstruction, but they could also come because they've been looking at augmentation or I suppose the opposite of that even.
Yeah, next Thursday evening at the Village at Pelham, which is out on Highway 14, we're going to talk about lots of information regarding plastic surgery. We're going to focus on breast surgery because it's Breast Cancer Awareness Month. But you're right, many patients, potential patients, feel a little uncomfortable coming to an office before they get additional information. Well, here they can be anonymous, have some good food, get some prizes.
And every lady that's in there is thinking the same thing you are. So you don't have to, you don't have to.
They're in good
worry about
company.
it there. You're in good company. All right. So again, that is October 18th. All the information on your screen. Dr. Lettieri, thank you so much.
Thank you, Kim.
I always learn something when you stop by.
Good.